national policy objective. The COVID-19 pandemic is still affecting most countries in the world. The COVID-19 pandemic has also forced people to stay at home. This was done to prevent the spread of the coronavirus. Therefore, most countries urge their citizens not to move outside the home if there is no urgent need. Coordinating Minister of the Economy, Angga Kurniawan, asked all Indonesian people to adapt to new conditions or new normal after COVID-19. Because as long as a vaccine has not been found, immunization has not been implemented, the virus is still there and will not be safer. The scenario of the new normal condition aims to strengthen from a health perspective as well as the economy. Health adjustments were made to suppress victims from COVID-19, while economic adjustments were made to suppress victims of layoffs and renowned socioeconomics. Government is also pushing for a reduction in the spread of COVID-19, especially in the infection and death rates. Then the most important thing is to encourage economic recovery by opening up economic activities.
New normal in the education sector policy. With the implementation of the new normal policy, several agencies in Indonesia have started to return to normal operation, but only note that these agencies are in the green zone and are required to comply with health protocols. Likewise, in the field of education, the government issued a new normal education policy where the policy aims to prevent and minimize the spread of the coronavirus while undergoing education during the new normal period. There are 18 new normal education policies, namely 1. Health screening process for all teachers or employees who have a history of chronic diseases. It is recommended to work from home only. 2. Carrying out a test COVID-19 that the test is recommended for all parties involved to carry out a COVID-19 test using the RT-PCR method according to WHO standard. If technically there are limited costs or regions, then the option can be carried pooling test with a sample size of less than 30 ohm. 3. The second passing of screening for teachers and employers who have passed the screening stage, they must be marked. 4. Virtual socialization. Virtual socialization is carried out a week before teaching and learning activities take effect, applying new patterns to parents, students, teachers, and school staff. 5. Setting the time for teaching and learning activities. Teachers are required to set the time for teaching and learning activities. Time KBM is set so as not to coincide with solid time traffic and reduce the duration of the school. 6. Data and check condition. Grade teacher elected shall record and check the condition of the student and parents of student in virtual as screening earlier if the students and parents side sick can follow the activity study of the home. 7. Student sitting position. Setting the position of sitting in a classroom and the teacher's room is 1.5 minimum meters. If possible, use a plastic barrier. 8. Teachers do not move classes. Teachers do not change classes. Strive to keep class teachers or not switch groups to virtual as screening earlier if the students and parents side sick can follow the activity study of the home. 7. Student sitting position. Setting the position of sitting in a classroom and the teacher's room is 1.5 minimum meters. If possible, use a plastic barrier. 8. Teachers do not move classes. Teachers do not change classes. Strive to keep class teachers or not switch groups to reduce the spread of the COVID-19 virus. 9. Maintain ideal distance. Maintain keep teachers away from students and are not mobile according to health protocol reference. 10. Conducting daily screening. Daily screening is carried out by student, teacher, and staff via cell phone. If student, teacher, and staff are detected as unwell 12. Then they are not allowed to go to school. 11. Not gathering. Delivers or pick up stop at designated location and outside the school environment and are prohibited from waiting for gathering. Just stop, put down, then leave the school. 12. Physical screening. Screening is carried out at the entrance of the school for teachers, students, and employees, which include a check on body temperature, mask, and does not appear sick. 13. The application of PHBS. The application of PHBS includes rules which consist of mandatory masking, spacing, no touching, getting used to washing hands, providing a sink and hand sanitizer. 14. Information. Information on COVID-19 prevention must be posted at school and classroom gates. 15. The use of disinfectant. Spraying disinfectants regularly in the school environment to prevent the spread of COVID-19. 16. Closing playgrounds eliminated or close of play areas or gather in the school area. 17. Work from home. Work from home is intended for teachers, employees, and students who are traveling outside the city and abroad given WFH time or study at home for 14 days. 18. Empowerment of school health units. School must prepare daily UKS and psychological support in school.
New normal policy in the field of public service. The new normal policy that has been implemented has forced alliance to adapt, including the public service system. The government, through the Ministry of Administrative Reform and Bureaucratic Reform, has prepared a strategy to welcome public service in the new normal order, including 1. Simplifying business process and service standard operating procedure by utilizing information and communication technology. With this new normal order, inevitably, the rigid and complex licensing service procedure will become simpler with the use of information and communication technology. 2. Using information media to compete new service standards through publication media. In this current era, social media is arguably very effective in publishing all government policies, including standard operating procedure regarding public service in the midst of a pandemic. 3. Opening online communication media as a forum for consultation and service complaints. With the assistance of online communication media, it is hoped that the public can consult or complain about service without having to go directly to service provider. 4. Ensuring the quality of output of service product both online and often remains in accordance with the established standard. The community's need for service is still quite high despite the pandemic. The leader of the regional apparatus organization or the head of the region is obligated to monitor the quality of public service in his area so that it remains optimal. 5. Providing excellent service while still observing the health protocols stipulated by the Ministry of Health. Please note, not all service units or regions can apply online service. In some areas, there are many obstacles related to the internet network, electricity, and so on, so that services are still carried out offline. That way, every provided to the community must pay attention to the health protocol established by the Ministry of Health.
Government police held a Pilkada in the COVID-19 era. A simultaneous election shall be held on September 23, 2020. But due to the COVID-19 pandemic, the simultaneous Pilkada has to wait until December 9, 2020. The police was taken under Article 120 of the regulatory regulation of the Pilkada, so that the appointed time for the implementation of the Pilkada was simultaneously postponed because of a non-natural disaster. Pilkada preparation, starting from candidate registration, verification, to campaigning, has been taking place since mid-June 2020. Even though the COVID-19 rate is still very high, the simultaneous regional election was forced to continue to be carried out because it was to maintain domestic political stability, and there were vast of a vacant position. In fact, in the statutory regulation number 1 of 2004, it is stipulated that there are executors of duties of regions whose term of office has expired.
All kinds of policies made by the government must have advantage and disadvantage. Likewise, with this normal policies following are the advantage and disadvantage of the new normal policy. First, the advantage of the new normal policy. 1. A new life order that will protect people from the threat of COVID-19 because people are familiar with the health protocols that were implemented before this policy was implemented. 2. Positive impact on the economy because this activity will be implemented soon but under health protocol. 3. Loosening of large-scale social restriction PSBB to allow many public facilities such as shopping centers to reopen as usual. B. The disadvantage of the new normal policy. 1. In the DKI Jakarta area, the new normal policy was implemented for the first application. In my opinion, it has considering the situation is still so precarious and the addition of corona positive patients is still happening, so that policy still does solve the problem. 2. In the field of normal education, a new program has also been implemented, namely the reopening school in the green zone, but the problem is that students still ignore health protocols. 3. Can cause the increase in corona.
Okay, my name is Yunia Rediana, NPM 1916041012. New normal during the COVID pandemic. Concurs over the weak response to the pandemic is known to have increased compliance with vaccination, especially by the middle upper class, the fall in mobility and consumption of the educated. Urban class has hit the economy hard, with the pandemic still far from abating. Forcing the adoption of the new normal is a big gamble, a potential second outbreak of the plague. The solution to the new normal policy, namely with the difference in the risk level of the residents of COVID-19 between regions, it is important to design a new normal the difference between regions. If this time the outbreak has subsided and the new normal becomes reasonable to adopt, then the protocol new normal should not be uniform, but different according to the level of risk of spreading COVID-19. The higher the risk level, the spread of COVID-19 in an area, the tighter of protocol new normal that must be adopted by the area. This is new normal protocol for all area, conferring rating first mask, face staff, and raising habit and maintaining physical distance. The new normal protocol for all other area is an increase in testing capacity, as well as massive tracing and tracing. However, from area with a higher risk level, the new, more stringent protocol should be enforced. For example, for high-risk areas such as urban area, school must still be closed, school from home.